Arthritis of the hip will typically present with pain in the groin area. Sometimes you can have pain in the front of the thigh or on the outside of the hip. Pain secondary to arthritis is much more common in patients in their later years of life, in their 60s, 70s, and later on. It would be less common for somebody in their 20s or 30s to have arthritis in the hip. So to definitively diagnose arthritis, x-rays of the hip need to be taken. The x-rays will show narrowing of the joint space. Oftentimes bone spurs and bone cysts will also be present. If you have arthritis in your hip, initially you'll want to be treated conservatively. Conservative treatment options consist of, first of all, modifying the activities that tend to cause pain in your hip, and anti-inflammatory medications can also be used. When your quality of life has gotten to the point that you're no longer happy and you want to pursue other options, that's when surgery should be considered. The good news is that hip replacement surgery is very effective at relieving the pain that patients are having from arthritis in the hip. Hip replacement surgery is performed on an inpatient basis, and patients are typically able to walk on the hip immediately after surgery without restrictions. Most patients are in the hospital for 2 to 3 days, after which time they're discharged directly home.